can find extensive bios of our three presenters on our website, but I'm going to just give a short introduction now, and you can see them on the screen here. Jenny Bossaller is professor at the School of Information Science and Learning Technologies at University of Missouri, Columbia. Lynn Connaway is a researcher, educator, librarian, and former executive director, research, OCLC. And Cristy Moran is a librarian, educator, instructional designer, and information literacy specialist. Now, with that, I will turn the conversation over to our own Professor Karen Dali of our Department of Information Sciences. Karen?
So much, and thank you so much for this wonderful introduction. And I'm going to go to our guests, Jenny, Lynn, Cristy. Thank you so much for being with us this evening, and thank you so much for agreeing to discuss this challenging topic. So I would like to start off with a question of how you became interested in this issue, because obviously all of you have different relationships to this topic. So let's go to Jenny first, and then move on to Lynn and Cristy. Jenny.
Sure. Hi. Thank you so much. So I got interested in this topic of a number of years ago. I've been involved in social justice issues since entering the field, but a few years ago, I don't know, probably 7 years ago, I started working on a paper with my colleagues Denise Adkins and Anne Janku. She was in the School of Health Sciences and worked as an advocate for people who had been sent to drug court. And she was also a yoga teacher who I went to her classes, and I saw her in the airport and we started talking. So that's how we got involved with this. So if you're not familiar with drug court, it's for people who are nonviolent offenders, but who have encountered problems with the law due to a substance abuse problem. So the drug courts are the programs that offer people the opportunity to enter long-term treatment if they agree to court supervision. They have to maintain recovery and make lifestyle changes rather than receiving a jail sentence. So the goal of the programs is to reduce crime and affect positive changes in people's lives, or to treat the disease rather than to punish the offender. So we wrote this paper about how public librarians could potentially expand their work with drug courts. And that began to shape my work in this area.
Thank you so much, Jenny. Lynn, how about you?
Yes. Thank you. It's nice to be here and to be here with my colleagues. Well, my entire career had been on user studies and information behavior, and I had read a lot about the opioid crisis in communities. And at the time, I was the executive director of research at OCLC, and Web Junction is one of our programs at OCLC. And so I talked to colleagues at Web Junction, and they were very interested in this topic as well. So we decided to submit a research grant to IMLS, and that was the first time that Web Junction had ever, and last, that Web Junction had ever submitted a research grant to IMLS. But we in the research division had several major research grants funded by IMLS. And so we worked together, which I thought was wonderful because it was both that research and the practice. And I think that was really important. And so we thought, and we worked with the Public Library Association. So both OCLC and PLA wanted to learn about and document how public libraries were responding to the opioid crisis locally, but with partners, any community partners. And so the project was called Public Libraries Respond to the Opioid Crisis with Their Communities. And it was funded. And so in 2019, we solicited 8 public libraries, and they participated in this research. And it was based on interviews with library staff, library board members, library leaders, the staff at the community partner organizations, also their leaders, and members of the community. So those who had used these services offered through the public library and these other agencies, and they could have been the opioid users, or they also could have been family members who were affected by the opioid crisis. And there's a summary report that shares the findings from these 8 public libraries, and also sharing the opioid response activities that these libraries implemented. And so, everything's online, so you just have to Google it and you will find that information.
Fantastic. Thank you so much for sharing this experience, Lynn. Cristy, what was your experience?
Well, first, I just want to say how awesome it is to have Lynn here, because that work has informed my work. So thank you, Lynn, for all that work that you've done. And I'm sure it's informed a lot of the work here among us. So I'm currently a manager of a branch, a public library branch in the North Metro Denver area. But right prior to this, for a few years, I was the Adult Library Services Senior Consultant for the Colorado State Library. And I like to call that position like the librarian's librarian for everyone in Colorado who works in a library that like even remotely serves adults. And one of in essentially creating the goals for that work and the kind of activities for that, one of the things I had to do was, talk to the people that work in libraries all throughout the state. So all these vast, really diverse communities, right? So you're talking about some communities that the library service area is like 2,500 people, and then you've got Denver, right, which is like a 1.9 million or some ridiculous, absurd number like that. And all these different types of communities served. And one of the things that comes up a lot in that, right, is this concept of we're not social services, we're not public health, but we are this resource navigator. And then what are the people who are working in the front lines in libraries seeing? And they're seeing the people who live in their communities, their neighbors, their moms, their kids, sometimes like literally dying, right? And so harm reduction became something that perhaps because it's my interest also in kind of social justice and really looking at kind of cross-sector collaboration and what is it that we can do with partners and looking at the kinds of work that different partners in the communities were engaged in already. And then seeing this issue come up of like, how can I serve folks who are ODing in my library? Because that's something that comes up, right? Or how can I get this resource out to the community that we can provide, but it's not a book, it's not a thing that I could put in a library of things, right? And so as that arose, and I looked at the data, work like Lynn's work, right? Work like looking at state board and state agency data dashboards, and it really became kind of prevalent, at least in my mind. And then knowing the kinds of conversations and like just general news that we see, right? The Sacklers, right? We see now all of a sudden dope sick, right? And so it becomes a part of the conversation that people in communities are having, and they're asking, where can I go for support and resources? So my aim really and how I entered this work is people asked and someone needed and a need was observed. And I felt like I could, at the state level, with the access that I had to cross-sector partners, right, that are doing work in public health and resources, I thought this is a really good entry point. And of course, then the overlap with older senior adults who are taking medicine as prescribed, but forgetting that they took it, right? And so now you've got a bunch of folks who are taking prescribed medication again and again and again. And so that overlap also with adult services, that's kind of more typical of the adult services, right? Like what are the older adults facing and how can I support them? So yeah, the same and kind of related entry points. Thank you for asking.
Thank you so much, Cristy. And it's really interesting to hear all of you describe your experiences because they're slightly different, but also quite similar in a sense that there is always some work with community involved, some personal connection, always like this. And it's very emotional and very personal on some level, but there is also research and assessment and other things. So all of you have been dealing with it for a while now. So my question is this. if you look back at your entire engagement in this area, what is your most memorable project? And I think we'll go to Jenny first and then move on to Lynn and back to Cristy.
Yeah, thank you for this question. It's great to hear your stories too, Lynn and Cristy. So I really have two projects they're part of each other. So it started with the paper, and then it led to this national forum. Several years ago, Bobby Long she's a faculty member at Emporia State, and she used to be in our program. She was a PhD student, and then she moved there, and she was starting to work on a project that had to do with information studies and alcohol use disorder. And we were sort of wondering, well, we set out to work together on a project about that. So we ended up pulling in Emily Vardell, who's also at Emporia, and she really works a lot with Medical Library Association and in the medical field. So we wrote this paper called "Connection is the Opposite of Addiction," which was about how public libraries are ideal spaces for book groups that tackle a lot of hard issues like addiction. So they have resources, they're for the public, they have skilled facilitators. And so, as the name of that paper says, it was also about how to facilitate groups, especially reading groups, for the purposes of bringing people into conversation and sort of creating some mutual support communities in the library, where they have the kind of resource support that we can offer. Um, so part of that, because we're all in libraries, is making more use of bibliotherapy, light bibliotherapy, in relation to how librarians might be able to help people who are experiencing these problems. So bibliotherapy is using books as a way to help people find their way through life's problems, and substance use problems are something that librarians see very often in their library, just as Cristy was saying, and both of you were saying. So it seems like that you would go really well together. So that said, substance use problems are really hot button issues in a lot of communities, and it's quite frankly scary. It's not an area that a lot of librarians necessarily want to tackle. So that's where the National Forum came in. So we brought in Noah Lenstra from UNCG, and we wrote an IMLS grant called Libraries Advancing Community Learning to Reduce Substance Abuse, or LECL. So that's online. You can see that. And that brought 50 librarians to the Kansas City Public Library. We also had some online participants and some awesome student helpers for a 2-day workshop to learn about ways that libraries can better support people who are experiencing substance use problems, including creating book groups and reading services as informal or non-clinical support. So the forum included sessions on harm reduction, community partnerships and marketing, bibliotherapy and book groups, and the power of connection with other humans in general as an antidote to loneliness and isolation. And those are major contributors to substance use problems. So and note that Dr. Dali here was one of the speakers at that conference, and she spoke about some of the limitations of bibliotherapy in a non-therapeutic environment. So I wanted to thank her for that, and point you all to the website. You can just look that up, but we've got a lot on there. So
That's fantastic. Thank you so much for mentioning both of these projects, Jenny, and drawing connections, because I was not even aware of the entire history of how it came to be. So thank you. Lynn, tell us about one of your most memorable projects.
Well, the most memorable was the public libraries respond to the opioid crisis with their communities. And it was memorable because of the individuals who participated in this study. And so, as I said, the research team conducted 8 research-based case studies highlighting varying opioid responsive efforts. And it was across 8 locations in the US. And so the research team, 2 of us, always spent 2 to 3 days in these communities. So we got a feel for the communities. We got to meet people from the communities, from the libraries, from the other community agencies. And in order for these libraries to be considered for the project, they were required to meet all of the following criteria. And that was have offered opioid response activities in the past 6 months, have worked in conjunction with a partner in the community on the opioid response activities, and to be engaged in opioid response activities offered directly to the public. And so the participating libraries who really, I mean, they gave a lot of time and effort to this was the Barrington Public Library in Rhode Island, the Blount County Public Library in Tennessee, Everett Public Library in Washington, Kalamazoo Public Library in Michigan, New Orleans Public Library in Louisiana, Peoria Public Library in Illinois, Salt Lake County Library in Utah, and Twinsburg Public Library, Ohio. And that's actually a place where they have a convention for twins. So Twinsburg, its name really has something to do with that community. So we visited, as I said, each site. We conducted 64 semi-structured face-to-face or telephone interviews across the 8 sites. So when we were on site, if someone was ill, or, you know, when you deal with humans, things happen. And so sometimes individuals were not able to meet us face to face, but then we talked to them via telephone or Zoom or Teams. And so as far as the interviewees, we had 18 community members. So more community members than any of the other different types of interviewees. 9 community partner directors, 8 library directors or assistant directors, 8 community partner frontline staff, 8 library frontline staff, 7 library managers, and 8 library board members. And so for me, you know, I was just talking about this today. I'm taking some classes in my retirement, and I was talking about this project, and I have interviewed thousands of people during my career, but this project to me was the most emotional, the most draining, but also the most fulfilling. And hearing the stories, and I will tell you, all of them were not uplifting or positive because things did not always end well as they do in a fairy tale. And you know, I carried around a box of tissues because the tears from those who are recovering addicts, from families and friends who have lost family members and colleagues and friends, um, from library directors, frontline library staff who had lost patrons, their users, people they knew in the community, library directors being called out by other community members because they were having anything to do with such a topic. And so it was really emotional. One of the things that we did learn that we heard about how the programs and resources helped to diminish the stigma of addiction. And to me, that was really good to hear. And how it made the recovering addicts feel as though they were human. And they said often when they attended these programs or activities, that was the only time that they really felt that someone cared about them, regardless of their addictions. And so these things really made it very personal for me. And it was a very emotional topic, very challenging for some of the library staff um, and the library partners. There were men, sorry,
Oh, no, absolutely. That's exactly, as you described, because every time you work with somebody with addiction and family members, there is this broader response to what's going on. Absolutely. And I'm so thankful that you're able to share it with us today, including how difficult it is to actually cope. So thank you so much, Lynn. Cristy, what about you? What is your memorable project?
So it's memorable, but it's like something I'm incredibly proud of. I think in a broader picture, I had to use the access I had as a state, like in the state library, right? How much impact doing something really big could be. 5.8 million Coloradans, right? Like now there's more, but I think that's the 2022 number. And one of the things that I needed to do was I can't do this work on my own. I have to find a resource that's already there, and whatever is working, let's just do that also. And in looking, I found this toolkit for school nurses put out by the Colorado Consortium for Prescription Drug Abuse Prevention, which is a thing I didn't know existed and is since my favorite partner. Shout out to Jen Mackender. And I created a relationship with them and literally called them email and said, can I have that, but for libraries? And it took months. It took a lot of, they were eager, right? But then I had to teach them what libraries do, right? Because everyone loves libraries up until the point where I start saying, like, you know, what libraries do. And then they're like, you do that? And I'm like, yes, absolutely do this. And you can find now a toolkit online. It's a website. It's in Jenny's toolkit. It is also on the Colorado Consortium for Prescription Drug Abuse Prevention webpage. I wanted to ensure it did not live in library land, right? In case there was too controversial for us. I wanted to make sure that it was there, right? And with the attacks on state libraries, I want to say I have a bit of foresight on that, and it will exist in substance use and substance use disorder harm reduction space, right? And so it's the Libraries and Opioid Epidemic webpage. So it's a toolkit. It's got us, you know, this is what libraries do. It's got links to the Good Samaritan Law, some Colorado-based things, examples of library policies on opioid response. In partnership with them, though, it didn't stop. It didn't like, I didn't only partner with them for this, right? So one of the things that happened throughout this relationship was that I was able to bring training, professional development, and even just the conversation to library staff all throughout the state. And so I would get calls saying, like, what can I do? And I would get calls saying, well, we want to distribute, we have this distro, we have like this kiosk, but we don't have access to the Narcan, it's all gone. And so I was able to connect them with naloxone. And so there are libraries now throughout the state that have naloxone for people to just pick up and take as a result of the work that I did, right? And so that's memorable, that's impactful, probably never more impactful than when I get an email from Jamie LaRue in Garfield County that Maria Gaitan reversed an overdose, and thank you for bringing that here. You know, and so I think that that kind of big, really like, oh, I've got this toolkit and this resource, that's great. And then this partnership, right? This cross-sector collaboration, this real relationship with Jen and Tomas and all of them was able to really carry through with actually delivering the box, right? And the fentanyl test strips, and let's get them a kiosk, and let's get them a vending machine, and getting them resources, right? And you know, memorable and powerful, and really, you know, something I'm proud of, and I hope that continues. At least the webpage will continue, right? I put it in a safe place. That's all I wanted, and all of you can read it. So yeah, that I can't speak
Absolutely.
highly enough of a partnership with someone like the consortium. If you can find one, make it work. Love them because they will love you.
Thank you. Thank you so much, Cristy. And I think, you know, your story is a perfect transition to the next question that I wanted to ask. In projects like this that are so complex, that involve medical issues and social issues and personal family issues, professional issues, issues with policy, how do you really measure success, if you do at all, or if it is in fact successful? So let's go to Jenny with this question first.
Sure, yeah. Well, from what I've done, it's pretty hard to measure success yet. I think there are a lot of other people working in this area because we're tackling these pervasive problems in our society. And I was really happy to put Cristy's toolkit on the website, and I want to more fully incorporate a whole lot of her stuff into our toolkit too, so that it's more linked together. But I think I'll know that the forum itself was successful if the people who attended the forum end up using the materials that we've created, that Cristy have created, and if they spread and if they evolve. So we're creating this toolkit, and you can access on their website. It's not complete, but everybody is able to reuse the stuff, take it, adapt it for their area. So, I mean, it's because every community is going to be a little bit different. We can offer templates, they can adapt them, but there are always internal and external factors like languages spoken and demographics and city-state politics, library funding and availability of partners, things like that. If they have a foundation or wealthy donors who want to support this type of work, all of that would influence how they're able to creatively tackle all of these problems. But there's some stuff in the literature that I wanted to refer to. So there are definitely programs that have found success. One of them is at the San Diego Public Library. They worked with the local health center to create a 12-week randomized control trial to connect unhoused participants with opioid use disorder to telehealth services in the library. So there they measured whether the clients were filling their prescriptions for buprenorphine, which is an opioid inhibitor. And they talked about whether the program was feasible and acceptable to the participants. So they measured all of this stuff. And through that research, they demonstrated one way that public libraries can serve as accessible telehealth hubs, bridging the healthcare gaps for marginalized populations, and that they showed that libraries can be a player in medication-assisted treatment for OUD.
Yeah, absolutely. And as somebody who participated in your symposium in May, I think, this interdisciplinary crowd was a really great place to be, a lot of positive energy and a lot of really great ideas. So, you could actually see that, this is something that people care about very deeply on a professional and a personal level. So I think it was a really successful event. So thank you so much. Lynn, you have spent so much of your professional life with impactful, large and small scale research. So what is your measure of success in this case?
So the research team measured success by, number one, the interest in the research by the library community and the numerous invitations to share our findings, whether in writing, in journal articles, or in presentations. Also, WebJunction received additional IMLS funding in 2024 to develop a course, and that course is From Stigma to Support, Libraries and the Opioid Crisis, and then a toolkit, Opioid Crisis Support Kit for Public Libraries, as a follow-up to this research. So that really signifies the importance of this. The libraries who were involved, those 8 libraries who were involved in this research, and I should mention that the Denver Public Library was our test site, and so they're included in our findings as far as the case studies, because they were really further ahead than many libraries at the time. And the libraries measured their success in various ways. So they conducted surveys of the community members. They had exit interviews with the partners. They also documented the participation in the programs and the use of the resources produced. Also, feedback from the community through social media, newspapers was also monitored. And also feedback from community leaders, staff, and partners. And the research surfaced the following major outcomes of the library's response activities, and that was increased relevant resources made available to the community, such as naloxone and drug disposal kits, a positive impact on individuals' lives, increased community awareness and knowledge about the opioid crisis. Also, the communities began to address stigma about substance abuse disorder, an increased positive perception of the library, which didn't always seem like that would happen in the beginning. And they developed new partnerships and expanded existing ones, resulting in coordinated efforts that better will meet the community needs. And they were able to reach out to other libraries and community organizations, which it opened that door for them. They had a success. And they were able to then say, look what we've done, let's try something else.
Yeah, absolutely. Thank you so much for sharing this. And Cristy, what about you? What's your measure of success, considering the work that you do?
Yeah, it's really hard. Before we actually started the call, I mentioned how the irony of all ironies, I go from like I'm pretty well known, right, where I am, and I go to manage a public library branch, and my district is not in any way engaging in opioid response. And they know me like really well too, and they know my work. And it is hard then to measure success and to say I've been successful in moving a conversation when literally the library in my neighborhood and now the library I work in is like, let's not have this conversation. So pulling back a little bit, the toolkit exists, right? You could Google it and you'll find it. And the conversations, I used to say my job was I'm a wildflower seed bomber, right? So I take these ideas and I like spread them out, and like I cannot take ownership of where they land. They're gonna look that I thought it was the one that was gonna take was this flower, but really it was this other one. And actually it looks this way. And sometimes I would see the product, right? Like the thing that came up, I just drive to Burlington, and I'd see something, I'd be like, oh my God, like I know that's not a native flower there. I know how that got there. And so just that moment. So I measured success of this, and I continue to measure success of this, not so much in my neighborhood, although I wish I could, right? And I always say ... yet, right? But it's really the conversations that people have, that I still hear people having, that Jenny invites me to be a part of this conversation, that we see people having this conversation in the field. It's uncomfortable. Like, who comes into libraries so that they look like bring someone back from an overdose? That's not what you walk in the door with, right? But to have a conversation that acknowledges that there's something happening in your community that's just not okay, man. Like it's just really not. And then how we can move the needle on having conversations then about other things that are just not okay, man. And what can we do then in partnership? So when I see an organization and a library partnering with a public health agency or their local, homeless shelter, and when I see that, and when I hear these conversations with professionals I know in my state, I can say that's a success. And then, yeah, when I get a call from Jamie telling me that someone was brought back, right? That's a micro, very micro, but to me, so incredibly impactful. Then I still get calls and emails, right? From people who have found me. Someone on LinkedIn will send me something. Someone will send me something to my Gmail saying, hey, who is that person that I could contact? That to me is a success, right? So, it's really hard because none of us, I mean, I used to make a joke like, yeah, tomorrow I'm going to like solve the opioid crisis. And that's like literally never going to happen. But then it's how can we destigmatize, right? And how can we pull back and say, this is not okay. It's one of the things that's not okay. How can I provide resources to connect my people, my neighborhood, my neighbor, my friend, the guy who's just visiting in from out of town to something that's going to potentially save his life, right? So, there's that big macro, big pie in the sky picture. And then there's the little really specific impact.
Right.
So
Right.
varying
And
measures of success.
oh, absolutely. And this connection between macro and micro is really very important because, kind of on the scale of a human life, if you bring, one person back, that all that matters. What else do you need? That's a measure of success, saving, one person's life. So I'm really glad that you mentioned it. And I'm really happy that you've shared all these different experiences because I wanted to ask you this. We have LIS students in the audience today. We have practitioners in the audience today. We have some faculty members too, but specifically thinking about LIS students who are still going through the program and practitioners who already practice but don't have experience, dealing with substance use. What advice would you give them on how to acquire some skills and competencies and knowledge and maybe some practical experience if they're interested in engaging with this issue as practitioners? So Jenny, let's go to you.
Sure. I'll just give some examples. So we've been sort of developing something in our program. So they might have some options to take classes in public health. So that's how we're working through one of these. Some schools, I think, are creating dual degrees with social work. That's another option. There's taking continued education on de-escalation and mental health first aid, and that's becoming really prevalent in libraries. So here where I live, our university extension people teach those to librarians pretty frequently, and I'm sure that they could teach that in classes as well. Several years ago, our school's advisory board told us that management skills were important, and several of them had gone back for an MPA, Master's in Public Administration. So that's one aspect of this. It's about, being a good manager, but I think it's fundamentally about relationships with other people in the community. So it's developing those soft skills. So being able to figure out who to talk to and how to talk to them, so that they recognize the value that the library can bring to their work is really fundamental. So there's a lot of work with partnerships. Lynn and I are working with Noah Lenstra on a book right now about public library partnerships. And librarians they can't do this kind of work on their own, right? Because sometimes it does cross into social work, and other times they need a medical or a public health professional on board to do this work. So the library can host clinics, they can provide resources, set up those resources so that they're always available. So it's classes in like management, partnerships, communication. Those are important ones from my point of view. But another thing to note is that when libraries become good partners, their partners also promote the library. So it's really a two-way street that ultimately really benefits your whole community. But also, as students, become active in your state library association early on, or PLA or whatever. And because if these kinds of subjects aren't being discussed, discussed amongst those people, promote them through one of the special interest groups, because you'll make friends and you'll learn a lot as you come up with all kinds of projects to work on with people, and you can create your own communities of interest as you engage with as you grow as a professional.
Great. Thank you. Thank you so much, Jenny. It's really very helpful for both students and beginner practitioners who would like to engage in this area. Lynn, you taught in LIS programs, you've mentored countless students and emerging professionals. So what's your advice?
I suggest taking courses in psychology, public policy management, communication, and marketing. Sometimes we're not great at marketing, and also social work. Enroll in courses. PLA often has courses, Public Library Association. Your local associations often have workshops and courses. You can roll in the Web Junction courses. There are many online. They are free. So if you have time, you can do that. With my retirement, I got those master classes. That was a gift to me. And so those have been really fun as well, because you go in and out as you please. They're very interesting presenters and speakers. And I've learned a lot about like different things. I was on a panel at ASIST on AI, and I did a master class to learn more about what people were saying and thinking. I also think it's important to volunteer with different organizations within your communities, and you have various communities, and develop your social skills, your verbal and written communication skills. And Jenny said this, I mean, everything we do in life and that we do successfully involves building relationships and learning to compromise and negotiate. And so I suggest that you really put yourself in situations, sometimes they're difficult, but that will help you to learn and perfect these skills.
Yeah, absolutely. I don't think there is a replacement for experience. You're absolutely right. And, it's much easier to get this experience under somebody's supervision and mentorship than to start out as a librarian and kind of carry all the responsibilities. So I'm really grateful that you mentioned it. Thank you. Cristy, what's your advice to students and emerging professionals?
Yeah, I'm gonna not take the position of the LIS professor, and I'm gonna instead look from the field. And what I'm gonna say, I'm gonna echo both Jenny and Lynn in this, is that relationships are key. One of, I mean, I said it, like it was creating a relationship with a partner who became like BFF partner, right? And emailing and getting to know and having a cup of coffee. Is that soft skills? Is that charisma? Is that shared interests? Is that, it doesn't matter. But it was a cold email that ended with a friendship and a relationship, even after she left and went to the Adams County public school system, right? And then working with Kristen, who took over, right? And so it's a lot of work to build the kind of warmth and trust and vulnerability that it takes in order to do that kind of compromise. Because they wanted to come in and do like medical clinics and libraries, and I'm like, you are never going to sell that, nor would I ever buy that. And I'm me, and I'd never buy that. So imagine talking to someone on the other end of the spectrum. So it's a lot of relationship and compromise, and what does that mean? Another thing, and I will 100% back being very locally and hyper locally involved. I'm in Reforma, Colorado, I'm in the Colorado Association of Libraries, like where you are is where you should be. Those are where your network and your people are going to tell you where there's a job opening, but also what's going on in the community. What are you doing that I can do too? What am I doing wrong that I can do better? What am I missing that I'm not seeing because I'm not in that room, but you're in that room? And so it's building capacity through friendship and networking in a hyper local context. And again, that's relationship though, right? Like you don't have to be best friends, but it could see you and say hi. And that's the shared interest that we have as professionals or in our field. And also, and I want to say something that Lynn said, I think is incredibly important. Noah's work in this is also incredibly important. Noah Lenstra, please look him up. The partnership, cross-sector partnership. We are a part of a public sector ecosystem. We are not alone. They don't know what we do. My friends know that I am known for stuff and then send me things. And I'm like, look at whose name is on that. You're telling me libraries do that? I wrote it, right? They don't know. And they're following me on Instagram. So if they don't know, imagine the people who are taking you for granted because they think they know. So
Yeah.
being in partnership in your community, because your community is different from my community. So is opioid use a problem in your community for the unhoused or for older adults? So should you be, going to the homeless shelter and, oh my God, I can't find them, or should you be at the senior center, right? So it's knowing your community too. So all those, and it goes right back to relationship and being really humble, right? Like what is it that's there versus what is it you want to see? Yeah, so that's my advice. And it's maybe not so LIS grad schooly, but it's definitely, are you, wherever you are, that's where you are, and that's where you got to start.
Oh, for sure. But I think it is very suitable for LIS
Oh, for sure.
graduates and LIS students because, I don't know if we have any questions in the chat right now, but I did have another question for all of you, if you don't mind. How do you really deal with this resistance to the idea of engaging with substance use in libraries? Because something that we see in our in our student population sometimes is that folks say, okay, I'm in this field because I don't want to work with people. I'm here because I want to engage with resources, documents, technology. I want to stay away from people. And so we have a substantial number of students like this, but even students who want to engage, they can be resistant to the idea of engaging with this particular activity because there is, the level of tolerance, this is where they draw the line. So how do you approach this? I'm not even asking how you deal with this because maybe we shouldn't deal with it, but how do you approach instances like this? Jenny.
Yeah, I mean, I think that's fairly common. A lot of people don't want to be, they don't want the library to be involved in the first place because they don't really want people with these kinds of problems hanging around the library, right? They want to keep it family friendly and everything, and we all want that, They might be afraid that supporting people with substance abuse problems are going to enable them to continue using. Um, there are a lot of people who believe that the right thing to do is to get tough or have a no tolerance policy to involve the police. Um, but substance abuse runs the gamut, it affects rich and poor people, people who work two jobs, people who work none, loving parents and grandparents, people who wouldn't harm anybody. But on the other hand, it can exacerbate a lot of mental health problems and lead to very serious social problems, including losing your place to live, right? So, in so many places, we have problems with lack of affordable or no subsidized housing. Unhoused people become unhoused because of a drug problem. Anyway, they end up at the public library, is the point. They're here, they're in our community, and we we want our libraries to be really safe. But I think we have to acknowledge that fear that people have, first of all, about about working with people who have substance problems. Sometimes they do cause disruptions or put other people in danger. And this repeatedly came up at the forum, right? Especially when we were having conversations about harm reduction, which is designed to keep people who use drugs alive, hopefully long enough that they can make changes in their lives, right? So the library workers at the forum were nervous about how to discuss this with their board of trustees, about how to discuss it with the mayor and other decision makers. So I think whether public libraries want to be involved with it or not, they are in some way, unless they just kick people out on the street. So, I think just keep on honing in on this idea of partnerships. It's not like we are trying to do everything. We are working with other people in order to make this a better place for everybody to live.
Absolutely. Thank you so much, Jenny. Lynn, what are your thoughts?
Well, I think in this day and age, within the economic environment, you can't do everything on your own. And so you've got to reach out. And I think, there were maybe positions in libraries a long time ago where you could hide in a back room and not have to come out. I don't think there are many of those positions left. And and I realize that the environment has changed, society has changed, and libraries are changing and have to stay relevant, are changing with their communities. And so librarians and library staff are going to be asked to do things that you never imagined you were going to do. And I think it's important that they have support from the library administrators and management. They have coaching. They're prepared because it is a very different job than when I started, 40 years ago. Things have changed. And I think it's important to understand that to be relevant, you must change as well. And if that's something that people aren't comfortable with, I hate to say this, but maybe this isn't the area where people should be. Maybe there is another place for them. But I really think in this day and age, we have got to put ourselves out there. I mean, Jenny said it, Cristy said it. You've got to become involved in communities, not one, multiple. And in order to be effective and have an impact, you've got to do that. and it comes down to relationship building. I just heard someone say that they did a study and that the first form of communication that many of the Gen Zs want now is to talk face to face, which surprised me. And they said second was text messaging and third was telephone. So what's that telling you? That's telling you that we still want that human interaction.
Absolutely. And I'm so glad that you mentioning this, because sometimes as educators, we have a hard time convincing students that even if they work in traditional technical services, they will still engage a lot with folks of, from different backgrounds. It's just inescapable. So absolutely. Thank you so much, Lynn. Cristy, what do you think?
I think it's really important, right? So two things. So first, I'm gonna kind of reduce the kind of expectation here of you're gonna like be reversing overdoses all the time. No, that's not it. What a lot of us really think is important is being able to acknowledge there's a problem in a community, knowing that it's just not okay. And my own personal motto is just not on my watch. Right. So like stuff, I can't stop everything, but what can I stop so that I could say, you know what, that not on my watch. So that's an individual thing. That's something I, Cristy, can state for myself. And that's a level of comfort that I set for myself. And I think each of us and everyone in libraries has to be comfortable with understanding what's the role, what community am I going to be in, what kind of library am I going to be in, what kind of job am I going to have, and then setting that expectation of what is the not on my watch, right? And that could be on any topic. The next is to acknowledge that there are levels of engagement. Your library, my library right now, is not going to do some stuff that I, Cristy, I'm okay with doing. Even as a manager, it's just not my administration's vision, and that's okay. And I'm going to compromise and I'm going to live within it, right? But there's a level of engagement I can enter in. So I can have a public health agency come and do what parents need to know about teen substance use. And I can have someone come in and talk about harm reduction strategies for the older adult, right? And I can, so what is it that I can do? Then I've got some libraries who've literally got a vending machine, right? With like tons of naloxone. And so that's their level and that's how they're engaging. And then there are some folks who are doing off-site outreach events in clinics, right? A book club in a clinic. And that's their level of engagement. So the resistance is finding where is your, like, how do you overcome resistance? Where is your boundary? What are you comfortable with? And then what role are you playing in your job? Because maybe it's not a job for you, but then again, maybe it is. And it's just, that is not where, that's just not where you are. So finding the kind of what is the level of engagement in this and or other difficult topics, right? Is really, don't give up, right? There is a way to talk about it. There is a way to show a film. Also use community data, period. If there are people dying in your community, you have the data to show that that's happening. And then that's something that you need to confront. And I always kind of like data and vibes, right? It's the both. And so, yeah, I mean, work with what you've got, but also acknowledge where you are and acknowledge that there are different levels of engagement, not just for you, but also for each institution, right? Each organization that you're in. And it's going to flex and be different at different times.
Of course. Yeah, absolutely. Thank you so much. And folks, I'm going to turn it over to Maria right now, who is going to handle questions from the chat and Q&A. Thank you so much.
Yes, thank you. One thing that's coming up in the Q&A is, what are the acronyms? What's the name of that organization? What's that study? So I think maybe at the end, just to let everybody know, we'll put together a resource page, and we will make sure that you get access to that resource page with many of these resources. But we do have some questions. The first question is, in your experience, Is local law enforcement a hindrance or a support system? Following that, what are privacy concerns that come up with working with individuals and organizations? And I'll just leave it open to who wants to answer that.
I can answer. So privacy concerns is not something that I've encountered. And in my work with other libraries on the field, privacy has not been a concern, right? We don't take information at libraries. If someone comes in, if you work with an organization, there really is a limited amount of personal information that is shared. So maybe that's something that maybe in doing research is a little different, but at least in the practical serving at the moment or in creating the partnerships, that's not something I've encountered. Local law enforcement, again, would vary depending on the local law enforcement, right? In my experience, local law enforcement has been a non-issue, but will, for instance, the library that I work at prefers for us to call local law enforcement if there is an issue on hand, right? So again, where are you? What is your library's relationship to local law enforcement? And really, what's the local law enforcement's attitude about policing your library, about policing folks in your community? That's going to vary dramatically, especially when I'm thinking of the state of Colorado, I'm thinking of Denver, and I'm also thinking of very, very different communities, right? And varying, again, attitudes related to law enforcement and also attitudes related to the folks who are typically pictured, right? Not necessarily the typical user, but the typical picture of what a user looks like.
Yeah, I had a little bit to add. I saw that there was another question about if the role of social workers as well, and that kind of ties into this. I think part of your question might be about some of the privacy issues that social workers do deal with, right? Because they do a lot that is really more one-on-one. They might take people to appointments. They might do a lot of things that librarians just, that's not what we do. And so I think first of all, I think that having a social worker in a library is amazing, and I would highly recommend that, if you're able to add one, and you need one in your community, like if it's a larger library, especially, then that's the way to go because of things like this, because we just don't really we don't coach people in that way. That's not what we do. So, and you would get into some privacy issues there. So I think that's where that comes in. Does that help at all?
Yes, and that gets to the question about social work.
Yeah.
Since we're getting close to time, I'm not going to read that one. I'm going to read the last question. So, because we're going to have to wrap it up soon. So we have a question. How does a library's work responding to substance issue affect the organizational culture and morale for staff versus leadership?
I can address that a little bit because I think since we were outside researchers coming in, people were very honest with us and shared. And it's difficult. And even though you might have a very supportive board and manager and library director or CEO, it's difficult, especially for those in the front lines, because you are the one who sees these things. You are the one who has relationships with some of these individuals. And then you are the one who is there, giving the Narcan. I mean, these things do affect the staff and the morale and the leaders too. Many of the leaders went through a lot and still continue to have issues. It's very emotional. And so it's really important to talk about it, to have support for the staff, and to be able, some staff were just adamant, like, I can't do this anymore. And so to try to work with staff to find out where, can they put them somewhere else for a while in a different position that they're not dealing with this every day. And I will tell you, I usually don't get depressed. And when I was doing these interviews, I had plans to meet friends for dinner. I could not do it because it was so draining. It's an emotional strain. And so I can see how difficult it is for the staff. And it is a problem and it must be addressed as a community again, and to communicate and offer help and to support each other. And what we found, it was easier for the other partners, the other community partners. It wasn't as difficult for them, but I think they were better prepared depending upon what agencies they were in and what their background was and their training.
Hmm. Well, Lynn, Jenny, Cristy, thank you so much for this frankly intense discussion on the front lines and substance use. It was really, really interesting. And we'll be in touch about putting the resource list together. And thank you, Karen, for moderating. And thanks to everyone for coming. And take care.
Thank you. Bye.
Thank you all.